So yeah, today about vaginal douching, cleaning the inside of your vagina using water or other products, sold in shops. So no, it is not a good idea, whether you're pregnant or not, whether if you think it's to remove semen, maybe add a quickie in the morning to your husband or girlfriend or, or wherever, and it's there, you do not wash it out. It's not a good idea. I'll explain it soon. Whether you think it's to, I don't know, some people believe it washes away STIs after sex. Some people do it before sex to prepare. Sometimes people do it to remove an odor, from the vagina and stuff. What are the reasons? Also, after menstruation, some people do it to clean out blood. So, no, you definitely should not do that. Why? Because when you wash inside, right, you're changing the flora. The flora is like you're changing the environment of the vagina. It has a certain pH it has to have. It's a low pH, for the bacteria there. So when you wash, right, you're changing the bacteria, number one. Number two, you're irritating it. You're irritating the area around, and all these products, douche products, you don't know what's in there. So basically, also, so specifically, for example, when you do it after sex, right, actually you're pushing the sperm up and you might increase your chances of getting pregnant. And in any case, those guys are fast. So the moment the man ejaculates, that sperm is swimming up because there's attraction from the chemicals from the woman. Plus, number two, there are general contractions, which happen inside a woman, like around the vagina, inside, that area. So those contractions of the sperm move. So you washing is not going to help anything. So the vagina is meant to wash itself. It's meant to clean itself. So you should let it do that. And you should also know that it's quite normal. It's normal to have a mild odor in the vagina. Some people have that. Some don't. Some do. It's completely normal. But unless it's specifically intensive, then it could be an infection. So also vaginal douching, it increases your chances of getting a disease called vaginosis, bacterial vaginosis. It's where there's an infection of the vagina and you have this discharge. It's milky, like it can be gray and it has this fishy odor. So you have higher chances of getting that, and it might happen over and over. You also have higher chances of getting candidiasis, so that's like yeast infections, because you're changing the environment. So you give bacteria from other places the opportunity to grow there because you're leaving a space by cleaning out the bacteria which should be there. For example, bacteria from your urethra can come there and cause issues, or from up your urinary tract, it could be from your anus, right? Since the anus and the vagina are in close proximity, so bacteria can move from there and go there, and it has less fighting chances since you've removed the good bacteria. So as for the treatment, right? Well, firstly, what not to do, do not put garlic in there. We don't know where that garlic has been, and it's just not a good idea. And don't put yogurt, because yogurt, yes, it might have that same kind of bacteria which lives in the vagina, but at the same time, there are chemicals there, there are sugars. You don't want that. Do not stick anything you're not supposed to stick in there. Okay, so as for the treatment, I'll talk about it in general, but I'll also put a link to a site where you can read about it. And I still advise you to go to your doctor, because don't be your own doctors and diagnose yourselves, because you might give yourself the wrong diagnosis. So usually with yeast infections, they give you what are called their pessaries. So they're like this silicone things which are round, which you can put inside. Usually it's a one-time thing. You put it there for some days. Usually it has a certain dose, so it's absorbed inside. So you place it inside the vagina. Or you can also take a tablet called fluconazole, right? It's about 150 milligrams. So you take it once and you're okay. And then sometimes if those don't work, sometimes they give you creams. Creams you put at night inside intravaginally, so you have to rub them inside. Or some which you can rub outside, like one called imidazole. That's usually for breastfeeding women, because the breastfeeding women, you don't want to give them the antifungal drugs, the oral drugs, the one you take with water, because that's, breastfeeding, so you don't want to do that. So yeah. And also with girls from 12 to 15, they're given usually clotrimazole, so it's a gel you rub around, the topical one. They're usually not given tablets. So also other general stuff, for example, you shouldn't wear tight things. if it's a yeast infection, don't wear tight clothing. Don't wear, nylon. You should wear natural fibers, like something like cotton, something which is natural, which can absorb, and it should be loose. You can use emollients to wash. Don't use soap or water because sometimes it might be painful. Yeah. So yeah. And with bacterial vaginosis, usually they give you a drug called metronidazole.